good afternoon to all of you, the audience of the TV of Oman and other modes of transfer, social media. Yesterday we registered 1,067 cases, and this is the highest number since Covid-19 started in Oman on the 24th of February this year. This is unfortunately alarming. The reasons for that, obviously and unfortunately, the adherence to social distancing or physical distancing, the adherence to the instruction that were followed by the majority of you were not as good, I think, during the holy month of Ramadan and during the Eid. We are alarmed and worried that with opening of new business or more businesses, with people going back to work, unless they continue to follow the instructions and the healthy practices, this number might increase. Yesterday we did 2,747 tests. The total test we did since we started is 129,527. Those who recovered from COVID-19 exceeded 6,623, and the number will increase. Like many countries and in the region and beyond, the definition of recovery has been changed from 14 days to 10 days if a person or a patient is symptom-free. Unfortunately, since the disease started or the pandemic started, we lost 90%, the death 90%, saying that the death rate in Oman is 0.45% of those who are confirmed COVID-19. Also, there are countries which follow different definition of the causes of death. In Oman, any person who is positive for this virus, whatever the cause of death, we always count them as due to COVID-19. This may change depending on WHO regulation and other organization. Those who recovered, I've mentioned that already. We admitted since this disease started 1,057 patients to healthcare facilities in Oman, private and government sector. And unfortunately, we have about 99 patients in our critical care units, and the stay in the critical care units exceeds 2 weeks. The average is about 4 weeks. This virus is still spreading very fast. It is unfortunately changing worldwide. I don't mean mutation of the virus, that might happen. But the number of cases in many countries, especially in the southern hemisphere, might increase rapidly. In our region, in Oman and the GCC, the numbers are fluctuating, and unfortunately it will continue to fluctuate. The only way to reduce the numbers, the only ways are what is known to all of you: physical distance, wearing the mask, hand wash regularly. And last week I've mentioned that social gathering or visiting is allowed, but with conditions. First-degree relatives, very close relatives, yes, but you need still to keep your social distance, the 2 meters. You need to wear the mask. You have to assume that everyone is carrying this virus until proven otherwise. And since I've mentioned this, some of you who follow the international press, and I'm sure all of you, you've heard lots of talk about WHO said that the person who is carrying the virus but is symptomatic, the chance of spreading the virus is low. That unfortunately was misquoted and taken out of its content from a press release conference which WHO conduct daily from Monday to Friday. And one of the experts, Dr. Maria Van Kerkhove, she quoted a small study from Singapore, and part of that study showed that they might be. But as today, as we know, the virus can spread from those who are asymptomatic. So please discard whatever you might have thought, and all of us would have been happy if that was true. That's not founded. That's not founded. Also, what we know that the intensity of the virus load is proportionate to the spread or of infectivity. If you are during the first few days of symptoms, the person who's having the symptoms can spread the disease very fast, and that's why we urge everybody with respiratory symptoms, cough, fever, body aches, headaches, please stay at home, isolate yourself. If you have shortness of breath, go to the nearest health facilities, wear the mask, always wear the mask. Today, or this coming Sunday, is Blood Donor Day, and usually every year we celebrate this and we thank the blood donors in Oman. Unfortunately, we can't do it in person this year, but our thanks and gratitude to everybody who donates and will continue to donate blood. Also, we'd like to thank the 100 COVID patients who recovered and donated plasma, and the plasma was used to treat 100 patients in our hospitals as well. Social restrictions, or what's termed lockdown, which varies between countries, we started to ease that up in Oman, and there is a team and a technical team who decide when and how. Unfortunately, this is it's badly needed for the economy, but unless people and shops, places adhere to the instruction that were very clearly given to them regarding the number of visitors in each shop, regarding the mask, regarding the social distance, this might cause increase in the virus and more spread in Oman. So I thank you again for being part of helping us to reduce the load of this virus, to reduce the cases, and we'll need to continue the same. We have to learn how to live with this virus. Unfortunately, as yet, there is no specific medication. Unfortunately, as yet, there's no dates for the vaccine, and we don't know when that's going to happen. So taking precautions is the only way to reduce the spread of this virus. Thank you very much.